नमस्ते। हिरण्यगर्भादारब्धां शेषव्यासादिमध्यमां स्वामी श्रीरामपादान्तां वन्दे गुरुपरम्पराम्. Invoking the blessings of Lord Dhanwantari, today from the house of AVCRI, we are here to present general awareness on different aspects of Ayurveda on account of Dhanwantari Jayanti. So today let's discuss about the topic From Pain to Peace, exploring Ayurvedic painless techniques. Myself, Dr. Vinita Nair, Senior Medical Officer from the AVCRI. So most of us are aware about basic Ayurvedic treatments and have a misconception that Ayurveda is nothing but only about oil treatments. So there are different varieties of oil treatments, the poultice treatments, which helps to reduce pain definitely in the aspect of a long-term management. But there are some procedures in Ayurveda which helps reduce acute pain. So most of them will not be aware of such treatment procedures in Ayurveda, which comes under the something called the paramedical procedures in Ayurveda. So coming to the painless techniques in Ayurveda to control pain. So there are some procedures which explore the paramedical procedures for holistic healing. There is a branch in Ayurveda called Shalya Tantra, which has surgical and paramedical or parasurgical procedures in it. The parasurgical procedures are quite non-invasive in nature. The bloodletting procedures hold high value because Rakta is considered as a fourth dosha in Ayurveda. So in these procedures, we try to conquer the acute pain and tenderness, which is localized to a particular area, whereby there is minimal discomfort to the patient without any admission, which gives an excellent, amazing, and cost-effective results. And we have to note a point that there is not even a local anesthesia that is given during these procedures. So understanding paramedical procedures, there are specialized treatments to complement the internal medicines, which helps in nourishing and rejuvenating the physical and the mental well-being of the patient. So there are procedures on the left-hand side. You see a photo of Rakta Mokshana or leech treatment, wherein the leech is a particular insect, a worm kind of an insect, which is used for bloodletting in nature. So in conditions like chronic eczema, psoriatic patches, the varicosities, there will be localized impure blood accumulation, wherein this leech is put in that particular area and it sucks out the impure blood, by which there is immediate reduction in the pain, the tenderness, and the redness in the particular area. So these are very specialized treatments pertaining to the Ayurvedic paramedical procedures. And on the right hand side, you see the picture of some instruments which are used for Agni Karma. Agni Karma is a particular treatment where the cauterization or heat cautery is introduced to the painful part. So a tender spot is selected and treatment is given on that area, which will help immediately reduce the tenderness in the localized inflamed area. So the rod is made up of panchalohas and it is heated. Just a prick is given on the particular selected points. So this helps inhibit the peripheral nerves, the pain stimulating areas, which gives a localized reduction in the particular painful part. So while coming to a general overview of the paramedical procedures, anybody can just walk into the OPD, consult the practitioner, the Ayurvedic practitioner. Now, after thorough physical examination and interrogating all the details, the patient history, the physician comes to a conclusion whether the patient is fit to undergo the paramedical procedure or not. So accordingly, there are different indications for all these procedures, be it the bloodletting using the needle, which is kind of a venesection or puncturing the vein. There can be procedures as mentioned before, like using the metallic rod to do heat cautery. There could be leech treatments. All these, there are indications for each condition. So most of the time, to relieve the immediate pain, to reduce the inflammation, the localized inflammation pertaining to a particular joint, it could be a severe acute knee joint pain, an ankle pain. It could be sudden onset of a sciatic pain. There can be chronic ulcerations which are not healing. And there are certain contraindications where in certain medical conditions, for example, if the patient is on an anticoagulation therapy, there could be continuous bleeding from the site of venesection. So in such conditions, the pre-procedures are very important where the patient is advised not to continue their medicines like warfarin or so for at least for 4 to 5 days. Henceforth, these treatments are strictly to be done under medical supervision. In pregnant ladies, it is contraindicated. Wherever there has been a recent injury or a recent surgical procedure, it is again contraindicated. The procedure is generally non-invasive, very gentle and tailored according to the individual needs. The highlight is the procedure is not so painful in itself. There could be a very mild, tolerable pain. The patient will be explained everything beforehand. We get the consent and only then proceed with the treatment. The follow-up also requires, sometimes there could be a necessity for regular sessions, say in once in 15 days or once a month, or sometimes once in 2 months or 3 months. But at definite intervals, according to the underlying conditions, the follow-up has to be maintained. So the effectiveness that it has proven to reduce pain and thereby improves the overall quality of life and well-being of the patient. So this is an example of a leech therapy that gave amazing result in a chronic psoriatic patient. So where the granulation improves in the venous ulcers after doing leech therapy at the border of the lesions. So it promotes healing, reduces inflammation and improves the skin texture. So this is another procedure of Siravyadham where the vein is being punctured with a needle, wherein the accumulated impure blood that causes the pain or discoloration in the varicosities is let out. So we have to understand that unless and until the localized inflammation is not brought under control, the internal medications may not prove fruitful in the long run. So there is a metaphor or a simile given in the text of Sushruta Samhita, which says as water comes out of and the plant dies on cutting the borders of the field, vitiated blood comes out, thereby reducing the symptoms. So the stimulation to the sensory fibers is depressed, by which the pain signals does not respond to pain. So hence in the localized area, there is a reduction in the pain. Though all these procedures are minimally invasive in nature, does not require local anesthesia, there is no need for the patient to stay in the hospital. Say the most common indication of the Agni Karma or the heel pain, that most of the people come to the OPD complaining of heel pain. That is, the typical symptom is there is difficulty to get out from the bed and place the feet on the floor, which gives an acute tenderness on the heel due to a calcaneal spur or a plantar fasciitis. So this is a very common indication where Agni Karma or the metal rod is heated and pricked on the area, which does not require a hospital stay or a local anesthesia or just a post-procedure wherein a medicated ghee is applied and bandaged. The bandage can be very well removed the same day, evening, or the very next day. The patient can move on to their regular routines thereby. But according to the condition or the cause of the condition, say for example, if it's a security guy who has to stand for a longer duration, may have recurrent pain. So in such cases, the procedure might be required once a month, and along with the procedure, there will be some internal medicines which will help strengthen the muscular attachments to the bone, which will help reduce the water retention in the limbs, thereby improving their pain tolerance. So the internal medicine is also equally important alongside the procedure. So medical supervision is mandatory, which supports the professional practice and thereby reduce the symptoms. It improves the overall physical and mental well-being of the patient. So thereby there are better patient outcomes when it is done under strict medical supervision. It should be performed only under the guidance of a qualified practitioner. The patient should be aware of these protocols before giving the consent for any of such procedures. This will ensure the safety and effectiveness of the procedure done. And the proper pre and post procedure should be adhered to as per the guidance of the treating physician. So when should a patient seek medical attention? So whenever there is a persistent pain, for example, the heel pain or a calcaneal spur, when it starts affecting the daily routines of the patient, when there are chronic ulcers as in venous ulcers or diabetic foot or chronic eczema or psoriatic lesions that fails to heal, it starts affecting your all day-to-day routines. So that is the time when they should seek medical attention for such procedures. For long-term management and optimal benefits, it is very essential to combine the paramedical procedures with internal medicines, to follow the wholesome diet and lifestyle modifications as advised by the consulting physician. See, these are very mandatory to ensure a prolonged relief, to sustain the relief. So to conclude, paramedical procedures offer a powerful tool to promote the overall well-being of the patient. One can resort to such treatments upon consultation, especially for conditions like calcaneal spur that accounts to the majority of the heel pains, the plantar fasciitis where there is swelling around the ankles associated with pain while walking or standing prolonged time, chronic ulcers and wounds wherein leech therapy gives excellent relief, sudden acute even for the matter of arthritic joint pain, say for example a very tender spot on the knee pain, the shoulder pain or low back ache, the sciatic nerve pinching which gives an acute sudden onset of pain. So to consult a qualified Ayurvedic practitioner to explore the benefits of Ayurveda for yourself is very much essential. So we in the Arya Vaidya Chikitsalayam and Research Institute in the Dhanwantari campus, Ramanathapuram, Coimbatore, offer these solutions through paramedical procedures through our wing of Anusastra. Thank you so much for the patient listening. Any guidance, please do reach out to us. Thank you so much for the patient listening. Namaste. Have a nice day.